And hello again, welcome to Crush Your Mountain Health. We're talking with Dr. ADRIENNE Charles, who is a remarkable doctor. I want you to think about this. I'm gonna give you a little bit of a bio on her. She is a native New Yorker, much like myself, who received her doctorate of medicine from Case Western Reserve University of Medicine in Cleveland, Ohio. She completed her family medicine residency at Howard University Hospital in Washington, D.C., and is board certified in family medicine. Dr. Charles is a certified life coach who empowers type 2 diabetics and pre-diabetics to regain their health and vitality through savvy food and lifestyle choices. So she moved a bit away from traditional Western medicine in order to focus more on eating lifestyles and helping individuals to decrease their glucose levels in that way. And we're going to examine that for a little bit and talk with her. Dr. ADRIENNE Charles, welcome to Crush Your Mountain.
Thank you so much, Henry. Thank you for inviting me. I appreciate it.
Well, I want to go ahead and deep dive into things. I'm going to ask you a question. What caused you to move away from the traditional Western medicine model of treating diabetes and pre-diabetics?
I wouldn't say that I moved away from the Western model. I've moved away from SAD, the standard American diet, what we generally eat here in America, because that is the basis for a lot of the disease that I see in patients, from diabetes to hypertension, obesity, kidney disease, just all of it pretty much is food related. And so I find that I can write a prescription for those diseases, but if there's a way to change it through diet and reverse it, I would rather do that, because you live healthier. The patient doesn't have to, my patients don't have to spend their money on co-pays. They don't have to worry about losing their vision, the heart attack, the stroke, the dialysis, all those things that come as a result of poor diet and just not having the information. So I rather do real preventative medicine and get to the root, which is what we're eating and how we're living.
Indeed. I just heard recently that the idea from Western medicine is not so much to treat the disease, but manage the disease, to give you medicine to stay on all your life until you die, and that's it. I like your approach because it gives us a hope to have a good, healthy quality of life. Let me ask you this. How does a plant-based diet improve the health, the overall health of African Americans?
Well, let me explain a plant-based diet. A plant-based diet is a diet where the majority of your foods come from fruits, vegetables, grains, beans, lentils, nuts, seeds. And that would be roughly 75% of your diet. So your plate would be filled with that, 3/4 of your plate. And then 25% of your plate or less would be any sort of protein that comes from fish or animals. And studies have shown that young girls who eat less meat and have more of a vegetarian or more plant-based diet, they tend to have menstruation much later. And there's an association between how early someone starts menstruating or having their periods and cancer. So there are links. There are links between milk and diabetes. There are links with the hormones in the foods that are used to make animals grow faster than their normal growth period would be, and how it affects our bodies. So there are a variety of ways, but one of the biggest ways is the gut microbiome, and that's the bacteria that's in our gut. And what's been found is that that bacteria actually helps us process and digest foods. They've found links between the gut bacteria of someone who eats the standard American diet or a very meat-heavy diet versus someone who eats more of a plant-rich, plant-based diet. And so those who have more of a plant-based diet tend to have less obesity, they have less diabetes, the irritable bowel, inflammatory bowel diseases, all of those things they have less of because of that diet. And they've even done studies on the protein in plant-based foods versus animal-based foods. And they found that when you're eating meat, that it causes, even fish, that animal protein can cause or will cause inflammation in the kidneys, whereas the same amount, the same weight of vegetable protein causes no inflammation in the kidneys. And so I'm really trying to encourage and educate my patients on how to choose foods that will help them to regain their vitality and get rid of those aches and pains that we've come to just associate, oh, I'm just getting old. I don't claim that. I don't respond to that. So I think that when I have gotten patients to try it, they feel better, they look better, the weight comes off more easily.
Well, that begs the question then, when it comes to a plant-based diet, what would be the equivalent? Let's just say I want to move away from my good old ribeye, and I want to go ahead and substitute that with maybe black beans or some other some sort of protein-rich vegetable. How would I go about doing that?
Well, even vegetables have protein. So having a full plate of fruits and vegetables and grains will do that. Also, your diet would include nuts and seeds. So you would get your protein from a variety of sources. And so each of those sources have some amount of protein, and then all together would give you the amount of protein that you would need.
I've heard about paleo. What would that do, and how does paleo work for those who are for African Americans?
Well, paleo, if I remember correctly, is usually more animal, less fruits, some green, and just minimal carbs. It's more, I think, fat and protein based. And so while you can lose weight that way, I wouldn't consider it a balanced diet because we need the antioxidants that we get in fruits. We need what the amino acids that we can get in starches and sweet potatoes and potatoes. They have sweet potatoes are high in vitamin A and vitamin C, which we need for vision and our eyes and skin. So I would not say that that is a balanced diet, and I don't think it's sustainable for a lifetime.
So on the other hand, there's the discussion of the keto diet, which is somewhat of the opposite, if I'm correct.
Mm-hmm. Well, those all can have some short-term benefits, but ultimately can you live that way for the rest of your life?
Right, right, very true.
And that's
So,
the basic question.
yeah. Yeah. Now I want to ask you just a couple of things, and I know that your time is short, so I certainly don't want to encroach on that too much. I'm just grateful for you to be here. So the question I want to ask is, how does fasting, and would you recommend fasting for those who are diabetics, who have some sort of diabetes? And I'm asking you that because I've heard recently that under supervision, that can have remarkable positive effects.
Yes, there is something that has been on the rise within the last 5 years or so, something called intermittent fasting. And that there are different variations of it. And there is the most common is the 16-8. So in a 24-hour period, you would fast for 16 hours and then have a window of 8 hours where you would eat. Another is, I think, 2 days, separate days, non-consecutive days of fasting. And there is another one where I think you are limited to 500 calories. Intermittent fasting does have benefits. I would recommend that any diabetic who is doing that do that with their physician, with the supervision of their physician, first and foremost. But fasting does have a number of benefits. With fasting, they found that in some studies that I've seen, that when people are going to get chemo, if they have fasted prior, then you you have metabolized the sugar in your system, and the sugar is what feeds cancer. And it lives off the sugar that you're ingesting. And by fasting, that sugar is then metabolized. So when you go in a fasting, you receive chemo in a fasting state, um, it is more effective because the cancer cells are more vulnerable because they've been starved. The other thing is that there are things called senescent cells or zombie cells that have not quite died, but they can infect other cells. And by fasting, you activate other cells that go and look for weak cells that are not really serving the body, and they destroy those cells that will can be a nidus for disease. Um, so there are a lot of benefits to fasting. It also releases a lot of toxins, but it should be done in a supervised way if you're doing it for any sort of prolonged period. There is a Dr. Valter, Valter Longo in California, who has created something called the fasting mimicking diet. And the fasting mimicking diet that Dr. Longo has created, he actually sells it, and it is very popular. And so it mimics a fast, but you still have some nutrients coming in. And so there are a lot of studies promoting that.
Wow. Well, I'll tell you what, I don't want to, again, I don't want to take too much of your time, but I really thank you for this tremendous information, just that little bit. We'd love to have you back just to get some more information and pick your brains and explore your deep wisdom of medicine, of food, eating, and lifestyle, and of how it connects with our overall well-being. Thank you so very much for your time. Look forward to seeing you again. And guys, I want to thank all of you for keeping this station alive. If you like what you hear, if it is of value to you, please click the like, hit the subscribe, and leave a comment and tell me what you think. I know I don't ask for that often, but this time I really want to, because we want to have Dr. Charles back. Love to have her, as well as all of our other guests who have been so fantastic on all 3 of my programs. Listen, thanks again. You know what I say. Don't just climb the mountain, crush through it. That means keep going and don't give up. See you next time.